Thanks, Leon, for the introduction. Today I'll tell you about how a decade of research into the design of tissue-responsive biomaterials has enabled us to develop an adhesive material-based platform for the treatment of glioblastoma, which is one of the most deadly forms of cancer. First, I would be remiss if I didn't acknowledge the work of my team of scientists, clinicians, and entrepreneurs, including Dr. Artsy, who leads my lab, as well as Dr. Henry Brem, who's the chair of neurosurgery, and developed the initial polymeric implant for the treatment of brain cancer, Gliadel. So why brain cancer? This is a question I most frequently get asked. Well, despite our innovations in the molecular, surgical, and imaging capabilities of cancer treatment, we have been unable to move the bar on brain cancer. And in fact, 80% of glioblastoma patients will not survive 2 years after being diagnosed with cancer. This is even with treatment with surgical resection to remove the tumor, followed by chemo and radiation therapy. So let's look at some MR images to see why current therapies are ineffective. So here, you can see a post-surgical resection cavity. You can appreciate that it's very difficult to remove all tumor cells using surgical resection techniques. You can see that within 3 months, the tumor starts growing, even with the onset of chemoradiotherapy. This continues locally over the course of the next 3 months, and eventually will infiltrate healthy brain structures and can go as far as the contralateral hemisphere, which is the opposite side of the brain. This suggests that we need both a local and a whole brain therapy that is able to get all the tumor cells. But why aren't we able to do this currently? Well, as one of our collaborators at Dana-Farber recently said, the top 3 reasons that brain cancer therapies currently fail are drug delivery, and drug delivery. And as Hannah nicely introduced, one of the main problems with getting drugs into the brain is the presence of the blood-brain barrier. The blood-brain barrier is designed to keep things out of the brain, like pathogens that may be present in your blood, and while allowing things like vital nutrients to enter. However, the blood-brain barrier does not think that therapies are vital nutrients, and most of them are excluded. This prevents us from being able to treat a very heterogeneous disease like brain cancer, where one cell or single cells are not very responsive to the same types of therapy. To address these challenges, we have developed an adhesive biomaterial that can be sprayed or injected locally into the tumor resection cavity or tumor bed in order to mediate the controlled delivery of therapies. One of the advantages of our approach is that it is an adhesive. Basically, the same chemistry that dictates hydrogel formation dictates its ability to stick to the tissue. This allows us to keep the drugs at the tumor site longer and able to diffuse a shorter distance, which is important in getting all the infiltrative cells that seed recurrence in brain cancer. And you can see MR images taken from a mouse brain with a hydrogel the size of a raindrop and how it can persist up to 1 month, or in this case, a few weeks with our current formulation, to deliver the therapeutic agents. Now, you may not believe me just from seeing the images, so here's some mouse data. Here you can see the current oral temozolomide chemotherapy shown in pink. In the best case scenario in the mouse models, it only allows mouse survival up to 26 days. And you can see that's not significantly different than what we see with just leaving the mice untreated. Even with local therapy, which would overcome the blood-brain barrier, it is unable to significantly extend the survival of the mice. However, when we use our hydrogel technology, which enables both local and sustained delivery, we are able to achieve curative outcomes in over half of the mice, and when combined with current therapy, up to 80% of the mice. And we've done this in both patient-derived xenograft models, as well as syngeneic models. In the immunocompetent mice, we were able to test if our therapy induces protective immune memory, which allows the mice to reject tumors upon re-challenge. When we put them in the contralateral hemisphere, we saw that all mice that were treated with the hydrogel were able to survive. This suggests that the immune response induced by the therapy is potent and able to identify the tumor cells regardless of their time of recurrence. What's even more impressive about this is that this was done with doxorubicin, a chemotherapy that has been given to cancer patients for decades and isn't able to be used in the brain because it doesn't cross the blood-brain barrier. And when given in doses sufficiently to even get a little bit of it into the brain, it causes cardiotoxicity. So with our technology, we're able to address those shortcomings. Finally, we've also tested it with some of the novel immunotherapy agents that have come on the market and have been unable to treat current tumors, and seen that we're able to get 100% survival, as well as protection upon rechallenge. Our goal is to translate this technology to the clinic. We are currently finishing up our preclinical rodent model data and raising funds to be able to establish testing in a large animal model to establish our therapy's safety as well as tolerability in the brain. Because our ultimate goal is to be able to shift this curve for patients. Our ask to you is that you can help us identify people to help build the venture, as well as investors, and additional partnership opportunities with pharmaceutical companies whose drugs may benefit from being repurposed in this manner and able to help brain cancer patients. Because we truly believe that together, we'll be able to deliver efficacious results for patients by eliminating brain cancer at its source using our next generation polymeric materials. Thank you.